Thank you, Duo, for giving us the opportunity to share our initiatives. Good afternoon to our APPIS 2024 participants across the region. I am Bing, Novartis Communications and Engagement from the Philippines. So, in a country where breast cancer is the most common cancer in women, where 3 out of 100 are estimated to have breast cancer before reaching the age of 75, and diagnosed at a later stage, around 75%, then we need to think pink to innovate and spearhead activities that would improve the health literacy of breast cancer. And we recognize the role of media as a powerful vehicle to disseminate the accurate information, debunk myths, and even drive proactive health seeking behavior that will improve breast cancer survivorship. So Think Pink is a health reporting on breast cancer was inspired that breast cancer is not a death sentence. Novartis collaborated with I Can Serve Foundation, an advocacy group of breast cancer survivors and volunteers, and the Philippine Press Institute, the oldest media organization in the country. This initiative was also supported by the Pharmaceutical Healthcare Association of the Philippines, or PHAP, and APPISx. This initiative, which was virtually conducted, capacitated around 60 journalists across the country to become better storytellers on breast cancer. We even leverage on the power of digital and social media by conducting a Facebook live streaming, which allow us to generate around 3,000 views. So, to give you the output and the impact of Think Pink is the managing editor of Manila Standard and the seminar director of PPI, Joyce Pañares. Good afternoon, Joyce.
Good afternoon, Bing, and of course, you have to Think Pink. The Think Pink Fellowship supported journalists across the Philippines in writing in-depth explanatory or feature stories on breast cancer. Media plays an important role in promoting awareness on breast cancer, in improving health literacy among the public, and in sending the correct message that breast cancer is not a death sentence, and that enhanced quality of life and overall survival are possible. But beyond the statistics, these stories of our fellows gave a human face to this disease. The topics were diverse and all equally important. There was an explanatory piece on the National Integrated Cancer Control Act, or NICA law, a landmark legislation that aims to increase the rate of cancer survival and reduce the burden on patients and their families. A story on modern and targeted treatments presented new options other than traditional chemotherapy, while one on end of life care underscored the need for palliative care in a country of 113.9 million people and where there are only 75 palliative care specialists. The spotlight was also shown on the challenges faced by members of the Higaonon tribe in Cagayan de Oro, ranging from misinformation to lack of access to correct information. A story from Oriental Mindoro, on the other hand, discussed the challenges faced by male breast cancer survivors, starting from the use of the word chest instead of breast among most males, a reflection of the social stigma from having what is traditionally viewed as a woman's disease. By keeping communities informed, these stories will also empower breast cancer patients and survivors. The fellowship, in fact, reached a wide audience, with the millions of viewers in the respective media platforms that carried the articles. And in the PPI's News Commons alone, it has the collective reach of 24 million among its member community newspapers. But there were also unintended but positive outcomes from the fellowship. Sunstar Cebu, for example, felt so compelled to write an editorial on fighting breast cancer, noting that time is of the essence when it comes to early detection and management, as well as in fighting misinformation and disinformation. Our fellow from Mindoro was invited to moderate the launch of a volunteer doctors group, the Mindoro Breast Cancer Support Group. And on a personal note, 2 decades ago, I did a brochure on breast self-examination for a class in college. And I feel I have come full circle as inspired with the success of our fellowship. I also asked my students in college to produce their own brochures. Breast cancer stories, just like most health stories, suffer from what we call seasonal or event based reporting. Most stories come out in October because it is Breast Cancer Awareness Month, just as most stories on cardiovascular diseases are published mostly in February, given that it is the heart month. But diseases like breast cancer do not choose a season. Every day, there's 74 new breast cancer cases in the Philippines, while at least 27 die daily. Breast cancer also does not discriminate. Men and women alike suffer from the disease. So moving forward, being how can we as partners maximize the impact of our stories and continue the campaign to raise awareness on breast cancer?
Well, I truly agree with you, Joyce. Continuous advocacy on breast cancer is really very important throughout the year. So for 2024, we will continue with the narrative, keeping it active, alive, and impactful. We will create visually engaging social media cards using our fellows' narratives, and we will upload that in the various digital platforms of our partners.
Indeed, this is truly a meaningful advocacy, but we cannot do it alone. It takes a village to improve survivorship in breast cancer. And we must all work together and we must think pink.
Think, think.
Thank you for that, Bing. And now we have APPISx Taiwan. We have a report from Sharon Xiaofei Yuan, Professor and Director of the Graduate Institute of Clinical Pharmacy of the National Taiwan University, and Ms. Catherine Ho, Senior Communications and Engagement Manager of Novartis Taiwan. Welcome, Sharon and Catherine.